Welcome again. In this session, we will discuss the dosage form related factors which are going to affect the oral absorption. I am Dr. Kailas Mali, and you are enjoying the previous sessions on the drug absorption. In this module, student will able to understand effect of disintegration time on dissolution and absorption. Student will able to describe effect of manufacturing variables on absorption. Student will able to explain effect of excipients and nature and type of dosage form on dissolution and absorption. Dosage form factors. Very first factor, that is the disintegration time. Then the second one, that is the manufacturing variables, and third, nature and type of dosage form. So moving towards the disintegration time. As you know that the disintegration time, it is the one of the important parameter for the solid dosage form. If the dosage form is having low disintegration time, in these cases drug get dissolved at a faster rate. It is possible to decrease the disintegration time of the formulation by addition of the disintegrating agents, which promotes the disintegration of pharmaceutical dosage forms like tablets and capsules. Moving towards the processing variables. The first parameter, that is the method of granulation. You know that the granulation, it is nothing but a conversion of a smaller particle into the larger one. There are so many advantages we are getting by converting the powder form of product into the granulation form, as it becomes very easy to process. While manufacturing the solid dosage form, it is necessary to convert the API, then excipients, into the granulation form. There are two methods which are widely suggested and used for the granulation, that is the wet granulation and the dry granulation. More than 80% of cases we are using the wet granulation process. No doubt the number of steps which are involved in the processing, which are much more than that of the dry granulation and the direct compression method. As the name suggests, in wet granulation we are using the granulating agents, like it may be aqueous or it may be non-aqueous organic solvents like the isopropyl alcohol or the ethyl alcohol. There are few drugs which are unstable in presence of water, and second thing is that the formed granules in the weight granulation we have to suppose to try. So it is not possible to use the weight granulation method for the thermolabile substances. In these cases, we are using the dry granulation method. The number of steps which are involved in the dry granulation are less than that of the weight granulation. Furthermore, one new technique which is available with us to improve the dissolution of the API turns to increases the absorption, that is known as the APOC method. So this is about the method of granulation. Moving towards the effect of compression force. There are 4 cases I have shown here. The graph is plotted rate of drug dissolution versus compression force. In case A, as we are increasing the compression force, the rate of dissolution gets decreased. It is due to increase in the density of the solid, which decreases the porosity and leads to decrease the permeation of dissolution medium into the dosage form, and thereby there is a decrease in a drug dissolution. In a second case, as we are increasing the compression force, there is a increase in a drug dissolution, that is the rate of drug dissolution. This may be due to the consolidation behavior of the powder material. As we are applying the pressure on the powder bed, and during the storage period there might be chances of the cracks, and through these cracks the dissolution medium gets entered into the dosage form and promotes the disintegration and dissolution. Moreover, the case C and case D is also possible. As we are increasing the compression force, there is a decrease in a drug dissolution after a certain limit. Furthermore, the rate of dissolution gets increased. So in this way, the compression force affects the drug dissolution and ultimately the drug absorption. Moving towards the intensity of packing of capsule content. Diffusion of gastrointestinal fluid into the tightly filled capsule creates a high pressure within the capsule, resulting in rapid bursting and dissolution of the content. So, in this case, the dissolution of drug gets promoted. In a second case, it shows that the capsule with the final particles and intense packing have poor drug release and dissolution rate due to decrease in the pore size of the compact and poor penetrability of the gastrointestinal fluid into the formulation. This may be the case with the hydrophobic drugs. So this is the effect of intensity of packing of capsule content on the dissolution and the absorption. Let us move towards the excipients. So what are the excipients? Excipients are the non-drug components used in the formulation. They does not show any pharmacological action. They are inert, non-toxic and so on. They are classified into the vehicles, diluents, binders, disintegrants, lubricants, coating agents, suspending agents, surfactants, buffering agent, complexing agent, coloring agents and crystal growth inhibitors. I have cited here the few important excipients. We'll discuss one by one. First of all, vehicles. What are the vehicles? Vehicles which are widely used in the liquid dosage form to increase the bulk. These are classified into the aqueous vehicles, non-aqueous water miscible vehicle and water immiscible vehicle. In the case of aqueous vehicle, the drug is completely dissolved, so it gets absorbed well from the gastrointestinal tract. In certain cases, drug is not soluble in the water. In these cases, we can use the non-aqueous water miscible type of the vehicles like polyethylene glycol, propylene glycol. These are going to act as a co-solvent for the API and increases the dissolution rate as well as the absorption. The third category, that is the non-aqueous water immiscible type of the vehicle, for example vegetable oils. When we are using the vegetable oils to prepare the certain liquid formulation, as they are the lipophilic in nature and the drugs are not going to be absorbed well. But in the gastrointestinal tract, the bile salts are having a capacity to emulsify the vegetable oil and the drug gets absorbed into the lymphatic system and thereby bypasses the first pass metabolism and increases the absorption. But always it is not possible to use the non-aqueous water immiscible types of the vehicle while formulating the liquid dosage form. So generally we are using the aqueous vehicles like syrups and non-aqueous water miscible type of the vehicle like propylene glycol, polyethylene glycol and so on. Moving towards the second, that is the diluent. Diluents are generally used in the solid dosage forms like tablet and capsule. Diluent increases the bulk of formulation which are going to act as a filler. It is also known as the additive. All these diluents are hydrophilic in nature and addition of this diluent into the formulation which contains hydrophobic drug, the dissolution of these drug gets increased. So this is about the diluents. Moving towards the next category, that is the binders and granulating agents. Binders are the agents which are used to convert the powder into the granular form. We are using cellulosic material, starch, acacia, tragacan as a binding agent. One more, that is the polyvinyl pyrrolidine. There are few binders are there which gets easily dissolved into the water as well as the ethanol and isopropyl alcohol. In the case of binder, when we are using the aqueous binder, they give the hydrophilic environment to the hydrophobic drug and increases the dissolution rate. There are certain binders like ethyl cellulose. They are ethyl cellulose it is insoluble in the water and retards the drug release. So this is the effect of binder. Next excipient, that is the disintegrants. Disintegrants are the agents which promotes the disintegration of the solid dosage form and thereby the dissolution and the absorption of a drug. For example, cellulose derivatives, starch, microcrystalline cellulose, then cross carbonyl sodium starch glycolate, and so on. Next is the lubricant. What are the lubricants? Lubricants are the agents which promotes the ejection of tablet. Generally, we are using the metal stearates like magnesium stearate. Magnesium stearate, it is hydrophobic in nature, and during the compression it reaches at the surface of tablet and thereby prevents the wetting of the tablet. So there is a need to change the lubricants like magnesium stearate to the one of the water soluble type of the lubricant like sodium lauryl sulfate. So this is about the lubricants. Coating agents. Generally we are using in a sugar coating, we are using the shellac and jain to give the seal coat, and during the storage period there might be chances of polymerization and retards the drug dissolution. In the case of film coating, the tablet may get disintegrate within 30 to 1 hour, and when we are applying the entry coat, there might be chances of disintegration of tablet into the stomach due to conditions like achlorhydria. Next excipient, that is suspending agent and viscosity imparters or viscosity modifiers. Suspending agents are used to stabilize the suspensions. They prevent the settling of the particle and increases the viscosity of the suspensions. If viscosity gets increased, it affects the diffusion of a drug from liquid dosage form into the bulk of solution. This is about the suspending agents. Surfactants. Surfactants are the agents which decreases the surface tension between the solid and liquid interface. They are going to promote the dissolution by wetting of the particle. Sometimes surfactant forms insoluble complex with the drug and alters its dissolution. Buffers. Generally, buffering agents are used to promote the dissolution of the active medicament in the gastrointestinal tract, like citrate buffer, which are used with the ondansetron. Moving towards the complexing agents. For example, EDTA. EDTA is the metal chelator which is used in the formulation Sometimes this complexing agent forms the insoluble complex with the API and retards the drug dissolution. Coloring agents, that is the colorants. We are using dyes, different dyes into the formulation to impart the color. These are the very fine particle size and may get stimulated at the surface of the particle or the dosage form and thereby prevents the drug dissolution. Moving towards the crystal growth inhibitors, these are the agents which prevents the growth of particle. Generally, these are used to stabilize the metastable form of the drug, that is conversion of metastable form into the stable form. So, crystal growth inhibitors promotes the dissolution by stabilizing it and thereby the absorption of drug. So in all the excipients are having certain effects on the dissolution and the absorption of the drug. Moving towards the nature and type of dosage form. Solutions, as the drug is dissolved in the solution, it gets absorbed well from the gastrointestinal tract if it is having a proper lipophilicity. Emulsions. We are using O by W type of emulsion for the oral route of administration, and if the lipophilic drug gets dissolved, prepared as O by W type of emulsion, it gets absorbed well from the gastrointestinal tract. Suspensions are the agents. Suspensions are the formulations. The solids are dispersed into the suitable liquid and suddenly shows the lesser dissolution, lesser absorption than the emulsions. Powders. As you know, these are in a dry state and the powder particles should be weighted and then it gets dissolved into the gastrointestinal fluid. Capsules are divided into the soft gelatin capsule and hard gelatin capsule. Suddenly the soft gelatin capsule shows good dissolution rate than the hard gelatin capsule. In the case of hard gelatin capsule, we are filling the solid material, whereas in the soft gelatin capsule, the API is filled in the form of suitable liquid, that is the vegetable oil, and it gets absorbed well from the gastrointestinal tract as it is being emulsified by the bile secretions. Tablets are the compressed dosage form. It should be disintegrated into the gastrointestinal tract, then there will be the dissolution and the absorption. Moving towards the coated tablet. Film coated tablet shows good dissolution than the sugar coated, than the Enrich coated. In the case of sugar coated tablet, there might be chances of polymerization of the seal coat and thereby retards the drug dissolution. In the case of Enrich coated tablet, if the conditions like achlorhydria, it gets dissolved into the stomach and thereby the API gets exposed to the gastric fluid and it becomes unstable. Sustained release tablet. These are prepared as a non-disintegrating disc and sometimes there might be chances of release of a drug at once into the gastrointestinal tract and it becomes lethal to the patient. So by considering all these dosage form, the solutions gets absorbed well from the gastrointestinal tract than the remaining formulations. So in this session, we have seen the dosage form related factors like disintegration time, manufacturing variables, then the excipients and nature and type of dosage form, how it affects the drug absorption. Hope you have understand the concepts, and now it is possible for you to discuss and describe the dosage form related factors affecting to drug absorption. Thank you very much.